Susan Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department, joins me now. Good afternoon.
Good afternoon, ma'am. How are you?
I'm all right. Big headline yesterday is we went backwards a little bit. We moved from blue back to our yellow status with the state. Why is that? What's happened?
Yeah, we did. A lot of it relates to events that are going on in the county and the community and in the surrounding area. In the last few weeks, we've had St. Patrick's Day, we've had March Madness going on, and we've had our school district start going on into spring break. I think that in conjunction with us being able to move into the blue allows us to have more capacity, allows more people in to events and things like that. I think they're all just contributing factors to this. And I think it's just we knew this was kind of coming, and this is again an opportunity for us to mention redoubling our efforts as we move through the vaccination process here.
Yeah, the timing of it coinciding with the mask mandate moving to a mask advisory. Are we going to expect to see these numbers get a little worse? I know spring breaks just started, so we haven't even gotten those folks back in house yet. What are your thoughts?
Yeah, well, I think we're going to continue to see days in the 50s and 60s and 70s for new cases, especially as people travel to the southern states that seem to have more loose restrictions on social gatherings and things like that. And if folks are partaking of those types of events with people outside of the normal social circle, we're going to see that cross contamination, not just amongst family members, but across the country. And I think at least we're looking at another surge here for the next couple of weeks at least. I don't think it will be bad as Thanksgiving through the new year, but I think this is one of those times where school holiday means increase in cases here in the county.
Well, obviously that put us on notice going from blue back to yellow. Does yellow now even indicate anything in particular that we're supposed to be doing differently?
Well, I think right now, the county has continued to mandate masks inside county buildings. We as the health department met with our health board today, and they made a resolution to adopt the State Department of Health's new color metrics. So we'll be disseminating those out to our stakeholders. A lot of it is putting the onus on individuals and businesses to do what's best for them. Obviously we recommend wearing masks when you're out in public and around people that are not in your social circle, and we continue to recommend that. Ultimately, though, there's not a quantifiable number on any of the restrictions right now.
Yeah. Well, I know that earlier this week too, we announced that we would be doing a pop-up vaccination clinic in Carmel. That's this Saturday, correct?
It's actually Sunday from 9 to 5.
Yes. Okay.
So, yeah, go ahead.
Full out? Have you got all those registrations taken?
We are full. We are full. It took about 2 days, which was a little slower than I thought, but state made it a little difficult for people to find it initially. So we had a little bit of a slow start to get folks registered, but we are at 100% capacity right now. We'll be doing 1,000 doses from 9 to 5 on Sunday.
And that's the J&J, so these guys will get a stab and be all done.
That is it. Johnson & Johnson, one and done.
Nice. Might we be seeing more of these pop-up clinics in the future?
Well, we hope so. If you read the news, you see that Johnson & Johnson just had a quality assurance, quality control issue with a significant batch of vaccine, and that has rippled throughout the country, and the state's not received as much as it was anticipating as a result. But hopefully, once they can overcome that hurdle, we will start seeing more opportunities. It's wonderful to see. Almost every day I get a message from a business, a non-government organization, someone in the community wanting to help in some way to provide these types of opportunities to our community, and look at different locations, be it Carmel this week, Sheridan in the future, Arcadia, Atlanta, you know, Westfield, trying to get into these areas where we don't have established clinics, and trying to get in and help those communities as well. So it's been really amazing to see this community support as we move into this phase.
Great. Is there anything else you want to add? I didn't ask. Anything we need to keep in mind as we head into the weekend?
You know, I think the big thing, I was just on a conference call with Carmel prior to us getting together, and you know, there's some weather potentially this weekend. So if you're coming, bring an umbrella. You know, if you're not, make sure you enjoy the weather as much as possible. But again, you know, that we've been saying this for a year. We've got to be vigilant. We've got to maintain our tight social circles. You know, we're getting there. You know, we're starting to see proof that vaccine is working. You know, we're starting to see the older populations percentage of the total cases of COVID dropping as a result of this vaccination. And it's just going to take time. You know, so those of us that, you know, are still out and about in the community, we need to continue to safeguard ourselves, because no vaccine is 100% effective.
True. All right, that's Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department. We'll check back in with you early next week. Thank you.
Thank you, ma'am.